Now, Dr. Michael Levitt is a Sydney consultant and a member of a Western Sydney Hospital's COVID-19 committee. He is a past chairman of the New South Wales branch of the Australian Society of Anaesthetics, and he is a specialist in the management of difficult airways and fibre optic intubation, skills critical, obviously, in the treatment of the worst cases of COVID-19. Michael Levitt joins us now to discuss the lockdown and whether it was really necessary. Dr. Michael Levitt, welcome to Outsiders. How are you?
Hi, Rowan. Thanks for having me on.
OK, well, let's cut straight to it. Did we need the lockdown?
Well, absolutely not. I can understand that in early March, when people didn't know what was actually occurring, that people could panic, governments would panic. But curiously, we'd never had a lockdown for influenza, SARS, MERS, Ebola. You wonder why the reaction this time was so different, whether there was intelligence that we as the public, were not privileged to be able to be shared, this intelligence. We don't know why they've continued the lockdown, though. We've had a situation where the lockdown was clearly from the end of March, early April, when the curve was totally flattening, completely unnecessary. But governments hate admitting mistakes. It's very hard for a government to admit that maybe we overreacted and we didn't really need to lock down the entire economy and destroy it. And so they've persisted with this fiction that we need to persist with a slow release of the lockdown. If you have a look at the countries around the world that had the maximum lockdown and weren't an island, for example, the UK, Europe, they had terrible results. But what they, in common, failed to do was close their borders. And in fact, UK and Europe, if you have a look at Flight Radar 24 and have a look at the current flights, it looks like a hornet's nest of flights still flying in and out. Whereas if you have a look at Sydney or Melbourne, we did last night, there were 2 or 3 flights.
So, Michael, one of the great images that we keep seeing, and I think the one that will probably define this rather unhappy period, is the empty ICU units. We were told that the ICU units would all be overflowing. Private hospitals, such as the ones that you work in, were told you've got to stand down elective surgery to make way for this great wave of corona cases which were coming along. Tell us now, because I think people are pretty confused and don't really understand why our hospital beds are empty, why you can't have elective surgery in many cases, and yet there are no coronavirus patients. What happened?
Well, absolutely. The most underemployed people in the community are, in fact, today, ICU doctors, ICU specialists. They're all sitting on their hands. They've spent most of March donning and doffing personal protective equipment, waiting for this onslaught of patients which never arrived. We are tripping over ventilators now and personal protective equipment. The governments, federal and state, closed down elective surgery totally, but instead of doing what South Australia has done and restarted it, the New South Wales government, with a perfect political cover, and I believe the Victorian government's the same, Queensland government's the same, they've got perfect political cover. We save you from COVID-19. We'll have a gradual restart waiting for the second wave. And that second wave is never going to come. And so New South Wales Health, for example, are talking about that they're up to 70% of elective surgery, when in fact, on the ground, it's more like 25 to 30%. Orthopaedics has scarcely started. There's this massive waiting list that's going to take about till 2023, 2024 to clear. And it's even worse because a lot of the public hospitals have closed their outpatients. So the patients aren't even being seen to be put on the waiting list.
Rita.
Well, we've talked about the economic cost of this lockdown, and it's enormous, but there's also a very human cost. We've had mental health experts talk about the higher rates of suicide and mental health issues. But what about cancer? I know there's a lot of cancer specialists who are really worried about people not presenting early and not getting that early intervention. Can you tell us about the consequences of this lockdown in the medical field? Not just the longer waiting list, but
Well, yes.
the cancer patients and heart disease and all those other areas.
It's going to be, there's going to be a long-term health crisis which will totally diminish any COVID-19 effect, direct COVID-19 effect. Patients are not even going to their GPs because they're afraid of sitting in the waiting room. So they're not having that lump diagnosed. They're not having the blood in their bowel motion diagnosed. And so they're not actually being referred to the specialists. Now, the specialist, even if they could see the patient, and they're not getting the patient, can't operate on them or do the diagnostic tests like colonoscopies, because the state governments in New South Wales, Victoria, Queensland have cut back in the idea of preserving equality between the public and private systems, have shut down elective surgery both in the private and the public hospital. The private hospitals haven't seen any COVID-19 patients. So
I want to shift gears a little bit here, Michael. Yesterday we saw tens of thousands of people violate the social distancing regulations that we were told that we needed. If there is not a massive spike in infections in 2 weeks as a result of this, is there any reason for any of the restrictions on pretty much any other activity to stay? And I'm talking about, shouldn't we just be allowed to go to the footy, go to church, go to the pub, go to whatever event that we would like, because this has clearly been licked as a problem in this country?
Well, I think a previous Prime Minister said last few days that everyone should put on a black armband and go to the football to protest about not going to the football. Look, it is absolute. I think the state politicians agree with what I'm saying, and that is why people like Dan Andrews and Gladys Berejiklian initially said there was no problem demonstrating. They know there are no community cases out there. It doesn't grow on trees. You've got to have people infected to infect others, and there aren't any people infected. The only people infected are coming off planes and going into quarantine at the moment in Australia. We're very fortunate. We're an island, and we shut down our borders early. I don't believe you will see any spike from the protests. I don't believe you would see any spike if you had 30,000 people at the football, and I don't believe you'll see any particular spike from the protests in the United States.
So, Michael, going back from that to the joke of all the empty wards, and at your hospital, you told me, I think there are 19 theatres and hardly any work taking place.
Correct.
Is this a huge cost? Who pays for this? And you've mentioned the medical costs. What about the economic costs?
Well, for the state government, they're saving hundreds of millions of dollars a month by not operating. To operate costs money. It's like the Yes Minister episode where the most successful hospital was the one with no patients. They're not in any way interested in clearing the waiting list. You're only ever interested in clearing the public hospital waiting list when it has a political cost. And this time there is no political cost because it was a pandemic and we responded, and we have to keep everyone safe. It's very easy to scare people. It's very hard to unscare them. And therefore there was an element of support in the community in the early days. But when people start realising that people requiring public hospital care realise they need a procedure and it's going to take till 2023 to have that procedure, they'd better get their private insurance because they're not going to get it in the public system anytime soon. A good percentage will in fact perish before they're called up for their elective surgery.
And just very briefly, Michael, before we go, is there any chance, what's the comparison between things like normal flu rates, influenza rates or something? I saw an argument saying that we had historically low, there were only 208 laboratory-confirmed cases of influenza in Australia last month. Normally there's 30,000.
Correct.
Join those dots for us.
Well, in 2019, which was a very mild influenza year, 2017 was a terrible year, but in 2019 there were 138,000 cases in Australia and 298 deaths, compared with about 7,200 COVID-19 cases and 102 deaths. The deaths are the same people. The people who die are people who, by and large, are very elderly, in nursing homes, with a lot of comorbid conditions like dementia, diabetes, respiratory disease. There was no lockdown significantly in 2017 for the big flu epidemic when over 1,000 Australians died of that disease. So something's going on here that we are not being told about, which I cannot explain the overreaction of the government on this occasion. It's not only our government, it's every government. So I just wonder if there was some intelligence out there about a manufactured virus which obviously had, a greater danger to the populace than a naturally occurring virus.
Michael Levitt, thanks so much. Fascinating stuff. Go back to your empty wards. I guess we should be pleased about that at least, but very worrying what you have to say, because so many people have lost their livelihoods and the government told us that would not be the case, or that was what they were fighting against, and yet you've got empty ICU units, economy trashed, and as you say, Michael Levitt, there doesn't really seem to have been a reason to explain why.